Good morning, students. I am Dr. Madhvi Kevle, MBBS MD Anatomy, and today's lecture is about the vestibulocochlear nerve. So, let's begin from this flow chart. So, vestibulocochlear nerve, it is also called as the eighth cranial nerve, and it consists of two different parts. The first part is the vestibular nerve, and the second part is the cochlear nerve. Now, the vestibular nerve is responsible to carry the information regarding the equilibrium of the body, and the cochlear nerve is responsible for carrying the information regarding the hearing. Now, this is a kind of sensory nerve. Eighth cranial nerve is a purely sensory nerve. So, means it has got what it does, it takes the sensations regarding hearing and equilibrium from the inner ear, from the labyrinth of the inner ear, and supplies it to the some nuclei in the brain. So let's see uh, what happens. So special sensory, these afferent fibers, afferent means they are going, so these are going, and so these they will carry the information from the labyrinth of the ear to the brain. So they are afferent. So sensory afferent fibers. So what these sensory afferent fibers do, they come where they will terminate. They will terminate in the uh, brain stem. For this vestibular nerve, they will terminate in the vestibular nuclei, and the fibers which are carrying the information regarding hearing, that is the cochlear nerve, they will end in the cerebellar peduncle, inferior cerebellar peduncle. So let's see how it starts. So now we will study it from starting from here. So the vestibular nerve, it is arising from the pontomedullary junction, and from there it passes through the cerebello-pontine angle, or pontocerebellar angle, and then it enters the internal acoustic meatus. This inside the internal acoustic meatus, on this vestibular nerve, there is a ganglion which is called as the vestibular ganglion. This here, vestibular ganglion, also called as the Scarpa's ganglion, and inside this there are bipolar neurons. So these bipolar neurons will again carry the information. So these bipolar neurons, they will continue as this part of this vestibular nerve, and just inside the internal acoustic meatus itself, it will give three branches. It will give three branches. Which are the branches? Superior and inferior branch, and a singular nerve. So then all the three branches, they will come out of the internal acoustic meatus. And how do they come out? They will pass through the foramina in the fundus of the meatus. So there is a foramina specially for the vestibular nerve, and through this they will come out, and they will reach till the their destination. What is the destination? The crista ampullaris and maculae here. Crista ampullaris and maculae inside the membranous part of the labyrinth of the internal ear. Okay, so this was about the vestibular nerve. Now let's see the pathway of the cochlear nerve. So the cochlear nerve fibers, they are arising where? They are arising at the pontomedullary junction. So lateral aspect of pontomedullary junction, and then passing through the cerebello-pontine angle or pontocerebellar angle, then they come to the internal acoustic meatus. Yes, and here inside the internal acoustic meatus, towards its medial end, what happens? They will enter the a special foramen called as foramen for tractus spiralis. Foramen for tractus spiralis, and from here it will reach the modulus of the internal ear. So there is a part called as the modulus of the internal ear. So there it will reach, and inside the modulus here there will be a spiral ganglion. Again this spiral ganglion, both the spiral ganglions are made of bipolar neurons. So bipolar neurons are present here. So even in this spiral ganglion, bipolar neurons are present, and from here these neurons will innervate the spiral organ of corti. So these neurons will innervate the spiral organ of corti, and that is the pathway of the cochlear nerve. So you are expected to draw the pathways of every cranial nerve like this. So let's see the subsequent slides. So let's revise it again. The vestibulocochlear nerve, it has two parts: vestibular part, cochlear part. Vestibular part is responsible for maintenance of equilibrium. Cochlear part is responsible for the hearing. Now we already know that the special somatic afferent fibers are present. These are the fibers of the, so you have to write all this properly. For every nerve you have to describe in the specific way. So they are starting from where? From the membranous labyrinth of internal ear, and we have seen all the pathway. Now we have seen the detailed pathway for separate both the separate components of this nerve. Now let's see the lesions of vestibulocochlear nerve. Now as you know, it is responsible for the sensation of hearing and for the equilibrium of the body. So if there is over on the anywhere on the course, if there is a injury to the nerve, any part, vestibular part or cochlear part, what will happen? There will be loss of hearing, there will be loss of balance, which we call as vertigo, and there will be a ringing or buzzing sensation in the ears, which we call as tinnitus. So there is when can this happen? So there can be a condition called as acoustic neuroma, which is actually a benign tumor, but because it grows in size, it affects the vestibular nerve, vestibulocochlear nerve, the vestibular part mostly. So this is when the lesions of vestibulocochlear nerve will happen. Okay, I hope you understood this small lecture, and thank you very much.